Emily. And so with that, I'm very much pleased to welcome everyone to today's webinar of the Asaro Regional Platform on Care Reform. As you know, today we will be focusing on the new global guidance on kinship care. And so I welcome you all. And on behalf of UNICEF Asaro and Wakaro, I'd in particular like to welcome Ms. Patience Rupende of the Ministry of Public Service, Labor and Social Welfare of Zimbabwe, and Madame Victoria Zawai, who is the Director of the Child Protection and Development Division of the Government of Liberia. So welcome everyone. And thank you to Ms. Patience and Ms. Victoria for joining us today, and we really look forward to hearing your reflections on the work that you're doing to support kinship care. So as you may have heard, the webinar is being recorded, and if you haven't yet done so, we would greatly appreciate if you can put your name, the country where you're based, and the organization that you work for into the chat box. That's always very helpful to us. And then also if you can please mute yourself, so that will make the audio easier for all of us. For those of us who might be attending this series of webinars for the first time, just a few points on the regional learning platform. This was set up by UNICEF Asaro with contributions from Changing the Way We Care, and it's supported by Child Frontiers and overall made possible through the generous support of USAID. And it really provides an opportunity for policymakers and practitioners from across the Eastern and Southern Africa region and beyond. I mean, we just heard that we have participants from Brazil, for example, with us to really exchange learning on care reform. So there are a number of resources that are available. We have regular newsletters, webinars, policy papers that we produce, videos and case studies. And very importantly, there's also a help desk with which anyone from government or UNICEF can request support on care reform. And we will be putting into the chat box several links so you can visit the platform webpage, also our YouTube channel. We're also going to be sharing a link through which you can then really sign up for the platform mailing list. And just to note that on the YouTube channel, we have several new videos. This includes videos on demonstration counties for care reform in Kenya, as well as kinship care in Zimbabwe, and that these videos are with subtitles in Portuguese and French, so to really increase the accessibility. We'll be taking questions at the end of the webinar, but please don't hesitate to ask questions in the chat box as they occur to you throughout. So the chat box will be monitored and we will do everything we can to respond to all questions. And rest assured that the slides that will be presented in the webinar today will be shared. They will be shared through a Google Drive folder, and we'll be placing the link for that into the chat box. And then finally, you will see that we are offering interpretation today. So the best way to do this is to hover with your mouse over the interpretation icon that you see at the bottom of your screen. You then choose the language you wish to go with, and very important, you mute the original audio. And we ask that you please also do this if you want to listen or speak in English, because this is very important for the interpreters so that they can hear what you are saying. So with that, we have a very exciting program today. I'll hand it over to Emily, who will give us a brief overview of the webinar. Over to you, Emily.
Thank you so much for that introduction, Nicola. So as Nicola mentioned, this webinar is going to be on kinship care, which I'm sure you're all familiar with this term, as I know we have a lot of care experts on the call. But just in case you aren't, kinship care refers to care by the extended family or friends of the family. In this webinar, we're going to be introducing new global guidance on kinship care. The process of developing this guidance was led by Family for Every Child, which is a network of national NGOs working on children's care and protection. but it's also been endorsed by a number of different agencies. The guidance has been endorsed by several different agencies, including UNICEF and Changing the Way We Care, and many of the other NGOs that are on this call today. So we're going to start with a presentation from Family for Every Child about what this guidance is about, and why it was developed and how it was developed. And then we'll go into a panel discussion where we'll discuss some of the key challenges and dilemmas related to supporting kinship care. We're largely going to focus on the Eastern and Southern Africa region, but we're really delighted to have the governors of Liberia with us from the Western African region, and we're also very happy to have one speaker from Brazil with us to talk a bit about lessons learned from Brazil as well. Just before we get started, I hope, if technology is on my side, that I'm going to share a short clip of a video about why supporting kinship care is so important, just to remind us about that before we get started. Okay. So this is from a video that we've developed as part of the learning platform, and you can find it on our YouTube channel. Unfortunately, the video is in English and the interpreters may not be able to keep up with the pace of the video, but Bertha will be sharing in the chat box. We've just uploaded versions of the video with French and Portuguese subtitles.
It's not something that is new, that is being brought from outside or external. It's something that is within our culture, it is within us.
If the children live with their kinsmen, they maintain their identity within the family. They also maintain their cultural heritage. They also grow up in a family setup, which is very important for children, rather than the institutionalization way of taking care of children. Growing up in a family setting, they will receive the sort of love that they might need.
A majority of the children that are in kinship care, they've actually expressed preference, towards kinship care than any other practice, because they feel, particularly when they are being taken care of by grandmothers, they are able to be given, the love that they can be given, by their parents.
Because government doesn't need to fork out more resources to cater for children in alternative care. That is in residual child care facilities, because they are very expensive to maintain.
Nengotochengeta kuti dai wakurawo kuti wakurawo iwe ndiwe wachazoziwa kuchengeta kwandakawaita kuti wasina kuti kana panesho wangoti pazvine basaba mwiri wandokurawo zvakanaka.
Okay, I'm going to stop the video there. Hopefully I've whetted your appetite to go and take a look at the full video after the webinar. Bertha has shared the links in the chat box. So I'm going to hand over now to Gemma Gillam and Suzanne Curlew from Family for Every Child to present on the background to the guidance and to share some of the key messages from the guidance. So over to you. I think Gemma's starting off with the presentation.
Thanks, Emily. I was going to start off with a very brief introduction into Family for Every Child and the work that we've been doing on kinship care. Family for Every Child is a global alliance of local CSOs and who focus on prevention of family breakdown, ensuring high quality alternative care, and the protection for those outside of any form of care. In terms of the work that we've been doing on kinship care, in 2019 and 2020, Family published research at the national, regional, and global level, looking at the use of kinship care, the benefits, and also the challenges being faced. The research consistently showed that kinship care was the most heavily used form of care outside of parental care, the preferred form for both children and caregivers, but often the least recognized and supported form of care. And when kinship care was being supported, the solutions were often simplified and not necessarily tailored to the specific need of kinship carers versus parents or foster carers. Family for Every Child then started to advocate for better support and recognition for kinship care. Over the last 2 years, Family for Every Child have been leading an interagency process to establish global guidance on how best to support kinship care. The process of developing these guidance has been a very practitioner-informed process and has included the establishment of an interagency group of 16 plus practitioners, a global literature review, key informant interviews across 25 different countries, consultations with 196 children and 215 kinship carers. The guidance has been reviewed by over 33 different agencies and shared on a digital community of kinship care practitioners with over 500 different members on Changemakers for Children. In terms of the guidance itself, the guidance is developed for policymakers and practitioners, in particular program managers, looking to establish or strengthen policy or practice around supporting kinship care. This isn't a step-by-step guide or intended to be read cover to cover necessarily, but rather recognizing that different contexts have different policies and practice in place, as well as different needs amongst the families that they are supporting. The guidance is designed and written in a way that users are able to access and focus on the relevant sections to them and their context. Each section is accompanied by a summary introduction and examples of promising practice. There is also a standalone summary document which captures the key findings and recommendations emerging from the guidance. To accompany the development and dissemination of the guidance and to ensure practitioner engagement and uptake, Family for Every Child have also been running a learning series on kinship care in parallel to this. Earlier this year, that consisted of a series of webinars, and in 2024, this will continue, but using a range of different methods of engagement, such as webinars, podcasts, and possibly virtual workshops. All of these continue to be accessible online, either through the digital care community on Changemakers for Children or through Family for Every Child's website. I'm going to hand over to my colleague Suzanne to share more on the more in depth on the content of the guidance. Suzanne?
Great, thanks, Gemma. So I'm just going to give you an overview of what's inside the guidance. And the first section obviously looks at what is kinship care. So kinship care can encompass a wide variety of different care arrangements. It can be formal and informal. And it is specifically looking at children who are living with family members or close family friends, relatives, but not with their parents. It can be care that lasts from anything to 1 day to several years or for a lifetime. Next slide, please. So why should we be supporting kinship care? Gemma's already mentioned a few of the reasons that came out, but kinship care was shown to have multiple benefits. It is the preferred form of care by children outside of parental care, and many children who live in kinship care grow up in loving and caring families. It also provides continuity and stability and a sense of identity and belonging, and access to social networks, including keeping sibling groups together. It's been shown to have better health outcomes and educational and emotional well-being outcomes that other forms of alternative care don't show. Next slide, please. Thanks. So continuing on with why we're looking at supporting kinship care. The deinstitutionalization debate has shown that kinship care is a really strong option. So it does offer an alternative to removing children from institutional care. It's also well recognized in the UNCRC in the guidelines for the alternative care. And caregivers also say that kinship care has a lot of benefits for them, for example, companionship or feelings of satisfaction from providing care for children. It's culturally acceptable in most contexts, and it is the most common form of care after parental care globally. It's also shown to be cost effective when compared to other forms of alternative care, such as foster care or institutional care. But in spite of all of this, what we do see is that kinship care families are not currently adequately supported. So the first section on principles in the guidance talks about some ideas of guiding principles or best practice around kinship care. The first is that it should be based on a contextual understanding. Each context is very different, and how kinship care looks in South Africa, for example, might be different in Brazil or Liberia. So it should be embedded in a local understanding of the context. It should enable the active participation of children and caregivers and other family members in decision-making. It should adopt a kin-first, best interest of the child approach. And it should recognize and build on existing strengths. So, for example, in South Africa, many children are currently living in kinship care. They aren't removed from another form of care and placed there. They're already living in kinship care. So how can we support and build on the strengths that are already being shown in those families who are caring for children? It should look at context-specific responses, and it should also be aware that certain groups might be more vulnerable, for example, children with disabilities, and they may require particular support. And it should recognize the fundamental difference between kinship care and parental or foster care. They are different forms of care, and they require different forms of support and different forms of recognition. So the section on creating an enable environment for kinship care looks at the importance of making sure that we have a sound evidence base upon which to make decisions and offer support for kinship care. It should look around the options of promoting kinship care. So how can we strengthen this form of care and make sure that it is recognized and widely used and promoted? There should be guidelines and policies and strategies to support the implementation of kinship care in countries and to support both formal and informal versions of kinship care. And this would include obviously strengthening the social services workforce. How can they better respond to the needs of kinship caregivers, even if this means that the placement is not formalized. So formalization shouldn't be a prerequisite for supporting that form of care. Kinship carers have needs, and children have needs across many sectors, and so we should recognize that it need to include a cross-sectoral coordination, and it should be properly financed and budgeted for in government budgets, so ensure that the services and support is adequately provided. And also it should ensure that social norms that exist are enabling and supportive of kinship care. So there are two main ways in which kinship care can be formalized. This is either through registration or through some form of endorsement, for example, monitoring and support by social workers. And kinship care, when formalized, it can be of value for clarifying parental responsibilities and also for ensuring protection and support for carers and children. But as I mentioned previously, support to kinship care shouldn't be contingent on its formalizations. And also there should be a degree to which caregivers can make a choice around whether or not to formalize the care arrangement. This section of the guidance on services and support for kinship care looks at what should be in place to best support kinship care. So there should be adequate social services and proper case management of particularly for formalized care arrangements, but also we should be encouraging how to support informal decision making. So when families are making those decisions themselves, how are we encouraging their decision making in terms of the best interest of the child, and thinking of the different factors that might influence that. It should be looking at providing information about services and supports that are available for kinship carers. And it should also look at protecting children. And this came up quite strongly in some of the consultations with the children. So ensuring that adequate protection is provided for children. Many children grow up loved and well cared for, but there is evidence that the risk for those children living in kinship care, there does exist a risk, and we should make sure that we're offering adequate protection. We can look at strategies to address poverty, support for emotional and mental health needs, and physical health needs. Many kinship carers are elderly and might require additional support in this regard. And we can also look at how we can improve education for children. Research just suggests that children in kinship care don't fare as well in education as they do as children in parental care. So how can we support that? How can we provide support to caregivers? And how can we maintain contact with siblings and their parents? So in conclusion, we've seen from the development of the guidance that kinship care provides a crucial contribution to the well-being, development and survival of children across the world. It is a unique form of care. It is also a complex form of care, and it requires a sophisticated response, and no one size fits all, and no similar response possibly or same response will work depending on the different contexts. So that needs to be done very contextually, but also not just at a national level, but for each family unit. We would look at the different caregiving needs within that family unit too. Children, young people and parents have much to contribute to meeting their needs, and consulting them and ensuring that they are part of the decision making is really critical. Kinship care is widely supported in most cultures across the world. It doesn't need to be regulated. So formalization should not be a prerequisite, but we should also be ensuring that adequate protection is provided to children. And kinship care has multifaceted support needs, and so it requires a multifaceted response across different sectors. I'm going to hand back over to Gemma now just to wrap up and share a little bit about the dissemination of the guidance.
Thanks, Suzanne, for that and the quick overview of the breadth of content within the guidance. So far, we've had the opportunities to disseminate and share the key findings from the guidance at a range of different conferences. The guidance is due to be shared online in the next couple of weeks and will be shared through the Changemakers for Children platform, as well as through the Family for Every Child website. And Family for Every Child will hold the official launch webinar at the end of January. We'll also be reaching out and asking agencies to support the dissemination and engagement with the learning series going forward. This is a snapshot of the number of a range of the different organisations who have already endorsed the guidance, and there are more coming on board. So please do reach out if you'd like to see the guidance and potentially endorse it ahead of the official launch in January 2024. And please do get in touch if you're interested in hearing more about the guidance, getting a copy of it once it's officially launched, or joining our learning series going forward, or even just being part of our broader conversation in terms of advocating for better support for kinship care. Please do reach out. You can either contact me directly on this email address, or you can join the Changemakers for Children platform, where we have a specific community for kinship care practitioners. Thank you very much for everyone for listening.
Thanks so much, Gemma and Suzanne. That was a great presentation. We will make sure that we share a link to the guidance via the learning platform monthly update. So Bertha's already shared the link in the chat box. Maybe she can share it again for how you sign up to that monthly update. And then we'll make sure you have versions of the guidance. And hopefully over time, the guidance will also get translated into other languages so that our French and Portuguese speakers will be able to view it as well. Okay, I'd like to invite the members of the panel to please put your videos on if you're able to do so, and then I'm going to introduce you one by one. First of all on my list is Blessing Mutama from Blessing. Are you able to put your video on or say hi? I think we may have actually.
Hi, everyone.
Hi, you're there back. Phew, I thought we'd lost you. So
I'm still around.
Good. Blessing is from the Farm Orphan Support Trust in Zimbabwe. And you saw him a bit earlier in the video. And next we have Suzanne, who we've already seen, who is from the Children in Distress Network in South Africa. Both Fost and Cindy are members of Family for Every Child. Elizabeth Blammer from CAP Liberia. Elizabeth, would you like to say hi?
Hi to everyone and to my colleagues from Liberia, Vic and Rajay. How you do?
Wonderful.
And bless.
We're so happy to have you. We also have Miss Patience Rapunde from the Ministry of Public Service, Labour and Social Welfare in Zimbabwe. Patience, are you able to just say hi? Okay. Hopefully, I'm just going to check if I can see her on the list. She was definitely here recently. Hi. Hi.
Hello, everyone.
Hi.
Oh,
Hi, I'm
wonderful.
Victoria from Liberia.
Oh, hi. Hi, wonderful. So this is Victoria Zawe from the who's the director of the Child Protection and Development Division, Government of Liberia. Welcome, Victoria.
Thank you.
Wonderful. And last but not least, we have Jonathan Hane from ASA in Brazil. Do you want to say hi, Jonathan? Okay. Hopefully he will appear again shortly. I think
está ligado.
Okay, there we go. You're there. Yes. Hi, Jonathan.
Oh.
Brilliant.
Bom dia.
Okay, wonderful. What we're going to be doing is asking the panelists a series of questions around how they've been supporting kinship care in their context. Right at the end, you'll have an opportunity to ask the panelists questions yourselves. So please do type any questions that you may have in the chat box, and I'll keep a note of those and ask them to the panelists at the end. So first of all, this question is for Suzanne and Jonathan. Perhaps Suzanne can start off. Can you tell us a bit about how you think the needs of kinship carers differ from those of parents or foster carers? I know this is one of the key messages from the guidance that Suzanne highlighted. Suzanne, do you want to kick off with that, answering that question?
Yeah, sure. Thanks, Emily. So, I mean, I think to start off with, obviously, we mentioned in the guidance, some kinship carers can be quite elderly. So they may have physical needs that are different to parents. They may also have suffered grief and loss themselves as part of the process of the child becoming under their care, and they might require some support around that. And then also something that kinship carers often talk to us about, and I think particularly in contexts where there's this feeling of duty of looking after children, where kinship care is so culturally normative, that raising a child in kinship care is different to raising your own birth child. And whilst they may be related to you, it isn't the same. Parenting them is not the same. And so they often experience challenges, that particularly when they hit the teenage years, of knowing how to respond and what's appropriate, and sort of kind of come head to head a little bit sometimes with the children, because they don't really know how they should be responding, and there are often complex emotional needs around that from both sides. So that's a little bit from our side of what kinship carers have shared with us. I can hand over to Jonathan to pick up some more.
Thank you. Please go ahead, Jonathan, if you have anything to add to that.
Então, bom dia a todos.
Oh.
Eu acho que
good morning, everyone.
Okay.
I think it's very important to make a difference when a child is being brought up in its own kinship care, but not with the parents. One of the important questions is that the kinship care needs to pay attention is to control the contact that the parents has with their own children. I'm talking about when the children are placed in the kinship care as a protection, because parents cannot offer the protection that they need. And there is also a question that is very different of going to a foster parent of a strange family, because when when they give support, we need to work with the family about their dynamics and the intergenerational dynamics for them to understand what happened and why they are in the situation they are now, looking after these children. They are not even their own children. I think that there is a question, as Susanna just said, there is a question, a social cultural, very common in Brazil. Families help each other and help to bring up children. But there is also another question, another matter. When the child starts living with another family, they are not the parents, sometimes is a complex situation, and the kinship care sometimes has to face the documentation, the health system, education. Many times it's not very easy to recognize that this kinship care is actually looking after the child, is responsible for this child. I don't know the time we have, Emily, but this is some of the points that I would like to mention.
Thank you so much, Jonathan and Suzanne. I think that's really helpful. And I think the kind of key message is that we can't really just bring kinship care families into family support programs aimed at parents or aimed at foster carers without adjusting those to their needs. So we need to recognise that kind of unique set of needs. Okay, the next question is aimed at Blessing from FOST. Could you tell us why you think kinship care is so neglected, and how can we advocate for more and better supports for kinship care? Over to you, Blessing.
Hi everyone. Hello, Emily. Can you hear me?
I can hear you perfectly.
Great, thanks. Yeah, so yeah, we have realized that kinship care in most contexts, I think just like what have been highlighted by Suzanne, is largely informal, and this has been confirmed in the research that we have done in the 7 African countries that include Zimbabwe and South Africa. And as a result, you know, the kins, here we are referring to grannies, the aunts, the brothers, the sisters who are taking care of these children. They're actually expected or left alone to take care of their own. And this is regardless the fact that children in kinship care are usually taken care of from the most poorest and isolated families. In Zimbabwe, 90% of orphaned and vulnerable children are being taken care of in kinship care, with over 60% of these being taken care of by grannies whose capacities are usually limited in terms of providing for these children. Now, when we reflect in most of the policies or the policy frameworks that we have in most countries, you'd realize that kinship care is silent, which creates a lot of problems when it comes to, you know, advocating for its support. I've also realized that most of the other forms of alternative care options, such as adoption, foster, talk of institutionalization, they're actually well covered in policy frameworks. You know, when you talk of guidelines, we've got adoption guidelines, we've got foster guidelines, like here in Zimbabwe, we've got guidelines that speak to institutionalization, or, you know, of children. And I think this is common in most contexts. But when it comes to kinship care, you'd realize that there are no guidelines, which makes it difficult when it comes to providing guidance on how kinship care can be supported. In the end, we have seen CBOs, NGOs, and other stakeholders just providing whatever support they can. But is it the standard that we want to be provided to these families? And in terms of information systems, are we able to coordinate and account for the support that is being offered to these families at national level? And then probably lastly, how much budget is how much budget allocation from our social protection is set aside for families in kinship care. When we do our national budgets, are there any funds that are allocated towards supporting, children and families in kinship care? And bearing in mind that, like what I've highlighted earlier on, that the majority of the orphaned and vulnerable children in kinship care, they are largely, the practice is largely informal, and when you look at the kind of support they get is very limited, and they are poorly supported. So yeah, I think these are the issues that I can share with you, Emily. Over to you.
Thank you. That's wonderful, Blessing. That's really helpful. So although we know that kinship care has been quite widely neglected, not just in terms of kind of government supports and also supports from NGOs working on care reform issues, not just in Africa, but also globally, we also know that there's some really wonderful examples of good practice in the region. And we'd like to bring in now the governments of Zimbabwe and Liberia to talk about some of their experiences in promoting kinship care. So could I ask Patience Rupende, first of all, from the Ministry of Public Service, Labour and Social Welfare in Zimbabwe, to tell us, please, what the government of Zimbabwe has been doing to support kinship care. Over to you, Patience.
Thank you so much for this opportunity, and let me go right into it. All right, so in Zimbabwe, I just want maybe to explain that we do acknowledge that kinship care has its foundations within the extended family, and we also acknowledge that over the years, due to various social ills and also obviously urbanization, globalization, these the extended family has been eroded and also being neglected due to even family tensions, poverty in some instances. And so the government of Zimbabwe, noting this rise in vulnerability, because obviously you know that once poverty is involved, once the extended family is also eroded, issues of vulnerability also come into play. So we take this into cognizance, and we have been taking this into cognizance. And we have also been implementing and developing various alternative care initiatives, especially in the presence of relatives who are sometimes not willing to support children. However, we are also working to ensure that kinship care is strengthened, and these efforts have been seen in various ways through review in legislation, review in policy, and even in the programs that we are implementing to ensure that we strengthen this kinship care element. And Zimbabwe is coming also from a background whereby we have had endogenous practices and indigenous knowledge systems, positive ones that have also, that are around the extended family, around kinship care, that have obviously promoted the protection of children within the community, within their family systems. So within our national development strategy, which is the economic blueprint of the country, we are also we are working to improve kinship care as a key priority, and we also have that coming out in our improved care protection of vulnerable. This is where it falls under. And you'll find that I spoke about legislation that has been reviewed. We have our Children's Amendment Act. So in our clause 15, we have the Act now provides something that wasn't there previously. It now provides for early intervention and family preservation programs that may be provided either by the state or through private organizations or non-governmental organizations. So this is also key as the government continues to open up to that support and coordination from various key players and stakeholders in kinship care and alternative care as a whole. So the purpose is mainly to provide a conducive family environment, develop appropriate parenting skills that then leads to family preservation, community strengthening, thereby facilitating sustainable community-based care. And I just also want to take note of a key priority of the government, whereby we reviewed our national orphan care policy of 1999, which previously did not cater for the promotion of kinship care. It only made mention of a 6-tier system, but now with the review of this policy and having the alternative care policy replacing it, the alternative care policy takes into cognizance the importance of kinship care and actually promotes kinship care in the process. So you'll find that the alternative care policy becomes a framework for the provision of care and protection of children living in various vulnerable circumstances, especially those without parental care. And then I also want to talk about how we also have provisions within the same policy that also cater for strengthening kinship care, specifically a dedicated area within that policy. And then we also find that we have various strategies that we have also been implementing. Amongst those, we have also taken part in the development and even the validation of the global kinship care guidelines here within Zimbabwe. I want to say that the ministry also took a key role in that process. And then in addition, I did hear a previous of the need for social protection. One of our key strategies are household economic strengthening initiatives, which we hope, if established well and to continue to also harness these gains, to be able to sustain families to a point where they can actually maintain their own and promote kinship care in the process. We also have other programs within the community that are community-based sustainable livelihood projects, that these social protection programs. We are trying to also move away from a place where we are just where we create dependency, but we also want to create sustainability and resilience within the community itself. So in addition to that, I think maybe in the interest of time, so I don't take everyone's time, I also want to talk about how the ministry and government as well is working on strengthening coordination of child protection in general, because we understand that we need a harmonized and some kind of concerted effort towards resolving community cohesion that would then add up to communities being able to care for children within the community. Maybe to also say the government has also been, there was an issue on financing. The government is also pushing together with partners such as UNICEF. Last year we held a high-level forum for child protection financing, so that we, as a form of advocating for increased financing towards child protection programs. And obviously, these once these actually, turn to fruition, we might be able to, we will actually be able to push towards kinship care. So in essence, the government only recognizes the importance of kinship care. It's not something that is alien to us. This is something that is natural to us. This is something that is part of our culture. So it's easier also for us to embrace it. It's something that we have always been implementing, whether officially or unofficially. And then to also say there are also official and unofficial ways of implementing kinship care in Zimbabwe. So thank you so much for the time.
Thank you so much, Patience. That was a wonderful summary of the work that's being done. And it's very interesting to hear about the multifaceted elements of that work, which I think reflect what Suzanne and Gemma were saying in their presentation on the guidance about how the needs of kinship carers are often quite complex and require multiple different interventions. Okay, I wanted to bring in Madam Victoria from the government of Liberia to maybe just tell us a bit about how you've addressed kinship care in Liberia, and particularly about the guidelines that you've developed on kinship care and how and why those were developed. So over to you, Victoria, if you're there. Wonderful.
So like other countries, Liberia too has a very vast way of protecting children. So kinship care is also widely practiced in Liberia, especially in terms of family bringing children from rural areas into urban areas in terms of getting educational support. But the issue of the guidelines came into prominence right after the war, around 2005, when we had a lot of children, close to 5,000 children who were in institutional care. And there were growing concerns of the number of children, and there was this need for deinstitutionalization. So around that time, the government also started this child protection system strengthening around alternative care. And then because of that, the government was able to get some support from UNICEF to start the deinstitutionalization process. And it had the development of a lot of policies, such as the regulation for appropriate care and contribution for alternative care for children to address the issue of residential care. And the development of the guidelines in 2014 was a very important step in that institutionalization process. So what was the need of the guidelines? The guidelines was there to ensure quality care of children, because the children who were in the institutions, there were reports that there were a lot of negative abuses around their stay, around the care into these institutions. And organizations and partners wanted to ensure that these children who were in these institutions were brought back into the family, because the issue is that people look at kinship care and family care to be one of the best options for children. So the guidelines process started with the ministry and UNICEF looking at partners, seeing how best they could be able to reform the system, and then develop a guideline that will be able to provide that kind of care for children. So a team of consultants were asked to be able to start the process of the guidelines. And there were interviews with key government officials, alternative care providers, community-based initiatives, children, and civil society partners who provided insight into how the guidelines were going to be like. And so the guidelines were developed, and then it looked at several sections. Firstly, the guidelines were kind of looking at independent living, foster care, and kinship care. So it was not only kinship care that was the focus. But again, in terms of that, there are several sections that the guideline look at. It looked at the definition of kinship care in the Liberia context. It looked at information on child welfare committees and community members about identifying arrangement for children. And then it looked at steps in which intervening in children could be so important. So there are several steps that the guideline talked about. It looked at the issue of kinship care and its place in alternative care. It looked at when kinship care is a suitable option for children, especially when there's a death of a family member, when there's abandonment of children by parents. Look at the possibility of parents being incapacitated to take care of their children, maybe due to physical or mental illness. And then looking at the issue of violence in terms of harming children physically, sexually, or emotionally. So what are some of the interventions that the guideline look at? It look at the process of supporting kinship care from identification to case closure, where you have social workers who were trained to provide case management. And then it outlined the key steps in case management, who is going to be doing what, who's going to take what action, what's going to be done, what chiefs, child welfare officers, NGOs, what's going to be their responsibilities. And also look at priorities in looking at other extended family members or household who could take over the kinship care responsibilities. And then one of the other key things is that you look at child welfare committees who should note or take records of the kind of care that is going to be made when the child is placed into this kind of foster and kinship care. Under the case management system, it also look at the issue of referrals, who will take what actions, it look at case planning, it look at placement and decisions. And then placement options for children, what are they going to remain in kinship care, what are they going to move to other family members, just in case that particular kinship care is not suitable. What are they going to move to non-family kinship care? Because remember, in the Liberia setting, we also have kinship care being other family, close family members. And then also look at the issue of temporary placement. Maybe you're going to look at first other things. So the guidelines are able to capture all the different sections to be able to provide the kind of quality care that a child will need when they move from institutionalization back into kinship care. And so we actually have been working with kinship carers, parents, and other family members. But kinship carer has been very one of the key things that the Ministry of Gender also look at, because we look at family being first. So in an instance where if a child also come in contact with the law, for example, they want to leave one other kinship care and going to another kinship care, the government also take that kinship care into consideration, because that's where the issue of the whole case management comes in. Realizing the fact that the whole issue of kinship care is not really regulated, except for the interim where the government gets into contact with that kinship carer. For example, like I said, if the child kind of get in contact with the law, or maybe get in conflict with the law. And then that's where the whole issue of the regulation comes in, where the social worker has to go in and show that the care the child is in is providing the quality care that the child needs, and whether maybe the auntie or the uncle understand the needs, and whether there's actual planning for next steps of that child, and whether the child wants to remain in that kinship care. So basically, that's what we do at the Ministry of Gender, and that's what the guideline take into consideration. Thank you.
Thank you so much for that really comprehensive answer, and it's really, really fascinating to hear about how you've responded to kinship care in Liberia. I've put a link in the chat box to the guidance so that people can see that. I'm going to move on. I'm going to stay within Liberia and ask Elizabeth from CAP Liberia to tell us a bit about some of the risks that children are facing in kinship care and how you address those risks through this work. And I think this answers one of the questions that has already come up in the chat box. So over to you, Elizabeth.
Okay, thank you. And so, as we all know, that kinship care is informal. It is informal in Liberia, and then this institution is very important, but it's not being widely recognized that there is a very important steps that we need to take to guide this process. And so there are risks that children are faced with, and because there is no monitoring of the system, and so it remains a serious challenge for the children. And so we see that domestic violence will take place, where children will suffer corporal punishments. And then many of them will serve as breadwinners, because as they come in and the burden is on the carer, so all of those challenges are transferred to the children, and then they put those harsh punishments, and then they send them out to do some business to bring in some fundings to support the entire family. And so we see those challenges there, those risks there with the children. There are also abuses that they undergo. They will suffer sexual abuse, they will suffer emotional and physical abuses in those homes. And because of that, you see that this child will have some low self-esteem, and because their voices are not even heard, they are not listened to. The communities will not listen to them, even the carers will not listen to them. And so, and then making it worse because it is not being widely recognized. I mean, they are just not listened to. And then you have the issue of poor parental care. The carer has their own children, as somebody said in their deliberations. They have their own burdens. And then you come out, you have additional children coming. It becomes a serious problem. And so the care is very poor. The children are not cared for as they should. They are not being loved as a biological child or children. And so they are always at the back. Supports are limited. Parents cannot afford, those carers cannot afford to support their own children, as well as this kinship children coming into their homes. It is their loved ones' children, but because of the challenges that they are faced with, they cannot afford giving them that support that they are needed. And so you see them with low education. They are not able to be enrolled into schools that will give them that quality of education. They will have poor health care. Some of them will not even afford to be taken to hospitals. And then, I mean, they are just in this unsafe situations. And so we see that the shelters even are not good. Clothing are not well for them. And then some of them, even the homes that the carers are living in, we would term them maybe slum communities. And so, I mean, to have a safe and caring environment is a real risk for majority of these children. And so we say, how can we address these issues? How can we? It is a holistic thing that is needed to be done. And so we talk about awareness, as I said. Kinship care, yes, we practice it, but it is not being well recognized. People are not even aware that this is called kinship care. This is your loved one. This is your child that you need to give this proper care, this loving care, and every other thing that a child needs to be provided to them. And so we need to have this awareness from a holistic view. From the government, the communities, the parents, the carers, the children themselves, they all need to have to be given this information about kinship care. And then we need to start to tell them about positive disciplines instead of these corporal punishments, sending them out in the street as breadwinners. We need to have them to talk about what they need to do. Let it be a positive disciplinary methods as alternative to corporal punishments. We need to have training and engagement with the child welfare committees in our various communities so that they too will serve as a guide in those communities to see what is going wrong and what is going right. Then we can all find or check and balance to see how these children are cared for properly in those funeral homes. And then at our level, we say we need this triangular relationship. We have CAP, we have the kinship carers, we have the children, we even have our child protection network. We have to see how the best opportunity to survive. And then we should ensure that these children are living in a safe and caring environment. Yes, we see that we have problems with support. If we look at our own guidelines, it talks about the social workers, their duties, but then the government, yes, they are from the social worker end, but when it comes to the funding, how can we support the carers and the children themselves? We do not have it, actually outstanding. And so even as we're talking, I know when we went to one of our meetings, we said we needed to do some amendment in that guidelines so that we see whether we add that portion, how could government come into support the carers to alleviate these challenges that the children are faced with, the risks that are surrounding them. And then the carers, because even as we went through, as we deal with them, they will always say, we are willing to take care of these children. These are our own kids, but then we do not have that economic power to support them. And so these are the things that we are undergoing in this process. And this is a very unique institution that actually need the support to sustain these children and give them a safe and caring environment. Thank you so much.
Thank you, Elizabeth. I think that was a really nice illustration of how valued and important kinship care is, but also some of the challenges that exist within those families and an explanation of the additional supports that are needed, and also how challenging it is to reach all of the kinship care families that are out there that's because it's such a common form of care. I'm gonna just ask a couple of additional questions to the panel, and then I'll move on to the Q&A, because we're getting quite a lot of questions in the chat box. This is a question to Blessing and Suzanne, and it's really about how other sectors can address and support kinship care. maybe Blessing, you could start off by talking about what Foster's done in relation to education and supporting kinship carers for education systems. And Suzanne, you could tell us a bit about Cindy's work in relation to social protection and ensuring that social protection systems are properly supporting kinship care families. And if you can keep your answers as concise as possible, that would be brilliant. Over to you, Blessing.
Right, thanks, Emily. So yeah, as an organization, we would like to see, all children, regardless of their vulnerability, would like to see them being supported to reach their full potential so that they can fully participate, in their communities. And in our work, we've realized that most children in kinship care who fail to complete their education, it's usually because of the challenges they face at home or in the community. And for us, we realize that the school can actually play a key role in ensuring that these children complete their education, which can then assist them, in future to access better opportunities of life in future. And we have also realized that most of the children who drop out of school, and because they are coming from very poor backgrounds, they end up getting married or recruited in child labor, where they face a lot of
Sorry, just give me 1 second, Blessing. I'm just trying to mute somebody. Please go ahead.
So they face a lot of violence, particularly when they have been engaged in child labor, recruited in child labor, or getting married early. So keeping the children in school can actually create better outcomes for them in terms of their well-being. So we've been working quite closely with the Ministry of Education to ensure that children they remain in school. And the schools have actually assisted us as an organization to identify children at risk of dropping out of school. And mostly these children are coming from kinship care families, which gave us an opportunity to provide the necessary support for these children. So we would work together with the school, because in most cases you find that the children, they spend most of the time at school. So you find the teachers have sort of become the second parent for these children. So they are able to identify if the child is experiencing any challenges, and we work together to try and come up with some response actions or response plans to support that child. Then the schools can also help in terms of monitoring the attendance and performance of these children, so that we will be able to provide them with appropriate support. We had cases of children who were missing out on school, because they had to attend to activities that contributed towards the household income. So yeah, you would have particular cases like children who are being taken care of by grandmothers, and the grandmothers, they don't have the capacity, to provide for those families, and then the children are coming in, to offer that support, to the granny instead, by going to participate in activities that would then contribute, to the household economic situation. But you find the challenge is now the child is having to miss school and attend to those activities. So we've then had to work together with the Ministry of Education and see how we can assist, these families, so that the children can continue to participate in school, so that their future is not affected. So yeah, for us, working with the Ministry of Education, we have seen it giving us better outcomes in terms of ensuring that the well-being of these children is actually achieved. Yeah.
Thank you so much. And Suzanne, could you just want to come in briefly on social protection systems and how they can be enhanced to support kinship care?
Yeah, thanks, Emily. And I think part of my response will also touch on some of the questions we've got in the chat around incentives for kinship care, because this is a commonly asked question. So in South Africa, we have quite an extensive social protection system, and the way the protection system has been designed is to follow the child. So it doesn't matter who the child is living with, but the primary caregiver of that child will be the person that receives the benefits. And so this is a way of ensuring that all children under a certain income threshold receive this form of protection, whether they're in kinship care or whether they're living in parental care or whether their care arrangement changes. And that's because we do know that many children, I think it's around 25% to 30% of children in South Africa, do not live permanently in parental care. So they may sometimes be in the care of their parents, but they do also move around. But we also recognize that for children who have lost parents, so who've been orphaned and are in the care of kin, that additional financial support might be needed over and above that sort of basic basket of support that's available to children living below a certain income threshold. And so we have a specific grant that is targeting those children in particular that has a slightly higher value than the child support grant. Just to put the child support grant in context, we have, I think, just under 20 million children in South Africa, of which 13 million are in receipt of the child support grant. So the Child Support Grant Plus, which is targeting children in kinship care, is in the process of being rolled out. It's just been introduced, and that adds on an additional 50%. And we did conduct some research. There has been extensive research across the globe around whether social protection schemes provide perverse incentives for children's care. And so far, whilst there may be cases, the overwhelming evidence suggests that that is not the case, and that for most caregivers, it reduces caregiving stress. It allows them to provide for things for the children that they may not otherwise be able to. And it definitely maintains those children within a family-based setting. And we did some research in South Africa in 2016, and that research affirmed all of those, but it also noted that it did, because it decreased the caregiver stress, it improved that caregiver-child relationship. And so not only material outcomes were improved, but emotional well-being was also improved for both the caregiver and the child.
Thank you so much. That's a great answer. And when we're able to share the guidance, you'll see there are questions not just for child, there are sections not just aimed at child protection professionals, but also those working in these other sectors like education, health and social protection, about how they can design their programs to reach what is often a third or a quarter of the children in the population who are in these kinship care arrangements across many African countries. So it's showing how those programs might need to be adjusted to meet their needs. Okay, our last question for the panel before we go on to some of the Q&A is to Jonathan, who's been very patiently waiting all the way over there in Brazil. So please tell us a bit about what you've learned about supporting kinship care in Brazil that might be useful for your colleagues in Africa. Over to you, Jonathan.
Desculpa. Eu queria focar na minha
I would like to focus my answer about one aspect that Elizabeth talked about, which are situations where the child are living a situation where he has suffered losses, violence, and other things. And what are the needs? What we have learned in Brazil is that when we work with the kinship care, it's a different kind of work than we would have done with children that are living with their parents. I think that Susanna now talked about the need, and Elizabeth as well, the need that when a child goes to a family, even a family, a child that is loved by the kinship care, this child brings costs to this family. And a lot of those kinship care, they are having already commitments with their own children, and sometimes they are in a very challenging economic situation. So this is one thing that we have learned, is the importance of economic support, financial support. In our experience, like Susan said, this doesn't motivate families to look after those children, particularly children that have difficulties in their development. And someone talked about the lack of self-esteem. And second, one of the things that we have learned is we have to give support for the carers, for the members of the kinship care, for them to be able to navigate through this complex need that is looking after a child that comes to join them in a very difficult situation, and sometimes in an emergency situation. Another matter that is very important is the establishment of spaces for the kinship care to be able to interact, especially the carers, because if you share experiences, if they share their experiences, they are able to strengthen themselves and offer a better care and not feeling like they are away from their own communities. And lastly, I would say that it's very important to recognize and to work with the children and their needs, because not just have their own traumas and losses, etc., they also have the question of interacting in a new family, and also the possibility to feel different from others, different from school friends that live with their parents. So it's very important to be attentive and listen to children and their needs. Thank you so much.
Well done. Thank you, Jonathan. That's really helpful. Thank you. The kinship care guidance are accompanied, as Gemma mentioned earlier, by about 40 examples, some of which come from Brazil. So when we share the guidance, you'll be able to read a bit more in depth about some of the great work that's being done in Brazil to support kinship care. So before we wrap up, we've had quite a lot of questions in the chat box. I'm not sure I'm going to get to all of them, but I will try my best. And I'm going to group them together a little bit. Some of them I feel like we've already answered, so some of them I'll skip over, but others I will delve into in more detail. So the first sort of set of questions really are questioning whether we actually do need to invest support to kinship carers. So there are kind of three questions linked to this broader question. First of all, are we sure that kinship carers aren't already being supported informally by like community networks and other members of the extended family? Are we sure that they're not getting enough support from those sources? And why do we need to support kinship care? Because it's already happening. It's already being very extensively used in the region. So why do we need to support it, to encourage it to happen further, if you like? And the final one, which is kind of linked to this, is around, should we be targeting social protection at kinship carers, or is that necessary, or can we just bring those grants into existing social protection schemes that may, for example, be targeted at foster carers? So I think those are all kind of interrelated questions. I don't know if anyone would like to, from the panel, would like to volunteer to go first.
Emily, I might ask to start if that's okay, just because we have
Wonderful,
experience. Yeah.
Yes. Great.
So I'll speak specifically around the channeling into the foster care system, because we have done that in South Africa, actually, and we've learnt some quite valuable lessons, I think, which are worth sharing. I think also, just to preface that whole discussion around, if it's interesting that we use the word incentivize kinship care, but we think about supporting foster care, and yet kinship care does show much stronger outcomes for children than foster care does. So I think that's the first thing to start with. Kinship care really has very strong outcomes for children, and so it's really valuable to support. The degree to which we need to support that, I think, depends on the context. And there may be some instances where informal kinship care perhaps doesn't need the same support as formalized kinship care. So the reason the child enters kinship care, I think, is something that we would need to consider. Whether we should be channeling children into the foster care system to give them some form of social protection support is what we did in South Africa initially. And what we encountered with that is that we totally overwhelmed our child protection system. So we were entering children into the foster care system. And actually what most of those families needed was monetary assistance. It wasn't necessarily all of the other things that children in the child protection system need. They were living in families where they were well cared for and loved, where they were safe, but they did need more support for material needs. And so we overwhelmed our child protection system by including them in the foster care system. When we've decoupled that, which is what we've just literally done now in the last 2 years, it's reduced the burden on the foster care system. It's allowed us to better respond to child protection needs, including for children in kinship care. But it also means that we're then able to free up social workers to not be doing administrative foster placements, which are very burdensome. They go through the court. They require much more monitoring and formalization. And so therefore they can focus on other needs of kinship carers, for example, parenting support, and other issues that kinship carers have said to us is actually more necessary for them than being in a child protection system. So I think it really greatly depends on the context, but I think we should keep in mind that kinship care really shows much stronger outcomes for children than other forms of alternative care, and that's why we should be prioritizing supporting it.
Thank you so much. Thank you. Anybody else wanted to respond to that kind of set of questions? Sorry, please go ahead. Yeah, go ahead. That'd be wonderful. Yeah.
For me, I think we basically have to go back to the idea of supporting existing structures. For example, the child welfare committees who are already currently working with families. And this is actually will be done on a case-by-case basis, especially for those kinship carers who will need some required skills to be able to provide quality care for the children who are being placed in the care. The issue of family strengthening is one of the key things, because like we talk about looking at care, family strengthening programs will be one of the key things that will be able to provide that care for. But again, it will be based on a case-by-case basis. And then because we know that kinship care is widely practiced, we'll kind of like see if we can narrow it down to children who might come in contact or conflict with the law. These children who are placed into the kinship care will be the one that will need, or maybe the financial support, the psychosocial support, the case management support, to be able to ensure that they are provided that care that they're already running away from, to find in the care that they've been placed into. I think that's what we need to support. Thank you.
Thank you so much.
Emily,
just before we go on to sorry, go ahead. Was that Blessing?
Yeah. So for me, Emily, I think support is quite a broad word, and support can be offered at different levels, you know, when you talk about support. And for me personally, I think it will be easy, you know, when we have guidelines, you know, as a country, we are then able to define what is it that we mean, you know, when you talk about support. And then we'll be able to say, is kinship care well supported? What are the gaps? Because we would have defined the kind of support that is supposed to be given to these families. Yeah. So it can vary, you know, by context, you know, when we talk about support.
Yeah, and I guess by families as well, they'll vary in terms of what support they need. Did anybody else from the panel want to add anything to that set of questions?
Yes, I want to add.
Elizabeth, go ahead, please. Yeah.
Yes, I'm saying that it is very important that we support this process. Just as Blessing said, from our various guidelines, we can actually state what are those supports that we're actually talking about. And then it will also help us. We talk about the violence that is being occurring with the children. And so that support will come from, reducing these violences that are happening, these abuses and all of those things. And so when we recognize that, yes, a child is in the care system, we need to look after them. We need to ensure that they are safe, that they are being protected, they are having all of the necessary things that they need as a child. That is a support. And then the psychosocial support to families, to the children, to even the communities, because somebody is coming into your home, even with the biological children, they need to have that psychological support. Why is it that my mom and dad is bringing another person, and then they are going to be sharing my meal and doing all of these things, even making some of those things that I'm supposed to have not available to me, and just I alone. And so that is the support. And so if we recognize and then we help, I'm sure we can get somewhere better instead of just leaving them, because yes, we started doing it from the time we've been knowing ourselves, we've been helping family members, so we shouldn't have anything to do with it. We need that support to families, to the children, to the community. That's my point.
Thank you so much. These are a great set of answers. And I think if I can kind of summarize, I think what we're saying is that before we start introducing new practices that are alien to a lot of cultures in Africa, such as foster care or adoption, we need to make sure that we are supporting the existing practices and strengthening them. We're not trying to turn them into something formalized or something new that they're not. It's just about kind of building those existing practices and recognizing that they may need a bit of extra support in order to be effective. Okay, I can see that Samuel wanted to respond, but just before I ask for people outside of the panel to come in, I just want to make sure we've had enough time to answer the questions that people have raised. So just let me have a look at this set of questions. Oh yeah. So does the panel think that the kinship care guidance themselves and some of your experiences on kinship care are addressing the multiple needs that children who are outside of parental care and alternative care have, such as access to social safety nets, interventions around early childhood development and birth registration? So do we feel that those issues are kind of being addressed adequately within the guidance? And also support for children with disabilities and early childhood development supports. Anybody want to come in and...
Sim.
Yeah, go ahead, Jonathan. Yeah.
Sim, eu gostaria, eu acho que é o guidance é o primeiro passo.
I would like to say that this guidance is the first step to look at all the complexities. And as Susan also mentioned, it's very important not to introduce new practices when they are not needed or extremely important, but it's more important to establish the support to children and families according to what they need. And I think that the international guide that is about to come out will set the path for every country to follow, so that every country can implement their own practices according to the needs of their communities.
Thank you. There are sections in the guidance on birth registration and how that can be challenging for children in kinship care, and as I've mentioned, social protection as well. So I think all of those issues that have been raised are kind of addressed. Okay, there's one more question which actually comes from Samuel, so I'll just make sure that we answer that question, which was around questioning whether there was a need to invest in kinship care, given that governments have very limited resources and kinship care is already being paid for by families. So why should we invest in kinship care given that families are already investing in this, and governments have very limited resources. Does anyone from the panel want to come in and answer that question? Blessing, go ahead.
Yeah, maybe my response, I think from the research that we have done, maybe you can correct me, Emily. I think is it in the United States where they say they're able to save about 4 million of taxpayers' money by supporting kinship care. So I think it's a practice, you know, that is actually cheaper even for the governments, you know, supporting children in kinship care than supporting children who are being put into institutions. So yeah, I think it should be supported.
So thank you so much. That's a very good and concise answer. And on that note, I'm afraid we're going to have to wrap up because we've just got a couple of minutes left. Sorry, Samuel, that we weren't able to hear your responses, but hopefully we can continue this debate offline. Just for Nicola to wrap up, and while she's doing that, I'm going to share a quick panel for you, a quick survey for you. And you can just answer a couple of questions so that we know who's in the webinar today. So if you could please answer those questions. Sorry, it seems to have listed 3 questions, but there are only actually 2.
Great, thanks so much, Emily, and thanks for the participants. We would really appreciate if you could complete the survey. This is very helpful to us, and it's a very brief one. So it was a very rich discussion, and I think we really had an excellent exchange on the crucial contribution of kinship care to the well-being of children, and really what extra support is needed, and that certainly it is really a multifaceted support that is required. Also because the needs of kinship carers differ, that is something that we went into. We did discuss the social protection component, and we also discussed the potential risks in kinship care and how these need to be addressed in order to really ensure that children in kinship care are living in a safe and caring environment, and ultimately, as we know, that really children themselves in kinship care, young people that have grown up in kinship care, parents and also kinship carers really know best about their needs and really have a tremendous amount to contribute to meeting these needs and to contributing to this discussion. And it was particularly interesting to hear the different experience from different contexts. So we heard from Zimbabwe, Liberia, Brazil, also South Africa. So I think it's a really wide range of experience. So we thank you very much for this great discussion today, for your active engagement, and appreciate your completing of the short poll. And then, as was mentioned, the guidance will be shared as soon as published. And we're also already planning our next webinar. This will be taking place in January. We will be communicating the date and further details as soon as they are available. So with this, I would like to thank you very much on behalf of the entire learning platform. We look forward to continuing the discussion, and we look forward to the next webinar in January. Thank you very much.